great, Chase. Thank you.
Great.
Welcome, everyone. Thank you very much for being with us today on the Frontline Conversation. I'm Doug Duncan, the President and CEO of Leadership Greater Washington. We started these conversations as a way to inform our members and others of what's happening on the front lines, of the people who are actually dealing with the effects of the coronavirus of COVID-19 and how they're responding to it in the region. So we started with Kathy Hollinger from the Restaurant Association, learned quite a bit of information from her about the layoffs in that industry, the hard times that they're suffering right now. And now we're with Radha Muthia, who is the President and CEO of the Cat-Lair Food Bank, which is an organization of enormous importance to this region, not just this time, but in all times. I mean, the amount of food they provide, the amount of people they feed every day of the year is extraordinary. And they've done a tremendous job. And now they're under incredible stress and strain because of the extra demands from people for additional food. We've seen lines miles long in other parts of the country. We've kind of avoided that here. But Rod, I want to welcome you. Thank you for being here. And I just want to start off by asking, how are you doing? How's it going? How are you feeling? You're at your office, which is unusual. Most people are at home. So you're very, very busy.
Thanks, Doug, and thanks for LGW for hosting this event. In terms of how we're doing, gosh, just about the same as how everyone else is doing, I think, in terms of, dealing with this pandemic, the uncertainty that we wake up to every day and just not knowing exactly what's going to happen, or, the rate of infections in our area, things like that. So I think we at the food bank, myself included, in that sense, have very similar feelings, maybe those roller coaster, emotions up and down as we think about our families, ourselves, those who are here and those who are further away. So that worry is similar, I think, for all of us. The difference, I think, for us, and maybe what's a positive part of this, is that it's good to be able to focus on something that is positive, productive, that, in ways in which we can help those in our community, at least address their food needs during this particular pandemic.
So what's a typical day like for you? You're in the office today. Is that something you're doing every day? And how is your workplace affected? I mean, how are people coming in, or are they working from home?
We have a mix. So we have about 120 staff across our DC facility, which is in Northeast DC near Catholic University, and then also out in Lorton, Virginia. So 2 warehouses and offices there. Our warehouse staff are in every day. And in fact, we are a 6 and at times a 7-day-a-week operation, given the amount of food that we're trying to get out to those in need. So our warehouse staff, volunteer coordinators, are coming in every day. They are, wearing all the protective gear that we have, but they're certainly in, and often working overtime, actually, even during the course of the day. Our office-based staff are rotating in, so we are all taking turns. I'm probably here 3 or 4 times a week, as are many of our directors, at least, a day or 2 a week that they come in. What we're seeing during this time is typically people don't come to the food bank to be able to get food, but they go to our partners, the vast network of partners, and we provide food to those partners. But in this time of uncertainty, people are showing up every day, many individuals, many families every hour. So our front desk and our volunteer desk, for those who've been here, are fully staffed all the time, just because we're handing out boxes of food to people who are coming in. So our operations continue. We're surprised at how we've been able to work well remotely as well. And I think it's platforms like this and others that enable us to do that. But the operations certainly continue, and if anything, at a faster clip and a higher rate than before.
So one thing that's changed is you have people showing up at your place of business asking for food. How many people a day are you seeing there?
So, those who come by, gosh, that's a few dozen each day, I would say, who are coming by with their families, many of whom have not been food insecure before. So they just don't know how to navigate this food assistance network. So, those who are coming to our facility, it's those numbers, but we have a hunger lifeline, if you will, for a phone number that people can call if they are uncertain where they can go to get their food. We've received over a 300% increase in calls into the food bank. So that has been a leading indicator for us in terms of the additional need that exists now. Amongst those who are newly unemployed, as well as those who, typically would get food from food pantries that we provide food to, but they, usually get 3 to 4 days worth of meals a month. And now, because the guidance is to have 1 to 2 weeks worth of meals in each of our homes at any given time, they're calling us to see if there are other places they can go to be able to get the additional food that they need.
You just got a nice shout out from Miriam's Kitchen, thanking you for everything you do for them.
Oh, they're fantastic partner. And we have so many, that there's not enough time, to get into all of them. But, the big names that people know of, like Miriam's Kitchen, Martha's Table, Bread for the City, Manna, so others might eat. There are many, of these partners who are actually doing even more than they would have before, because many of them are functioning as hubs for us. And so they're receiving and distributing just so much more food into the community than they would have before.
So you said you're getting 300% more calls in. Are your food donations in terms of food coming into you, is that increased?
No. So the supply of food, there's a very different story around that. So demand is what I was referring to there in terms of an increase in the number of phone calls and partners asking us for more food to distribute. In terms of supply, I'll step back just to explain how we and where we typically get our supply and how that's changed now. So as a food bank, about 60% of the food that we receive to then distribute onwards comes from, as food donations, from retailers and wholesalers. So Giant, Safeway, Amazon Foods, Target, Costco, Trader Joe's, you name it, and they are food donors to us. Another 20% of our food comes from the US government, from USDA, and that food is targeted to specific individuals, usually seniors and children. And then we purchase another 20% of our food. Now, so that's the 60-20-20 split, if you will, in terms of how it was before COVID. Now, we have seen a dramatic decline in food donations from our retailers. So we've seen about 75% decline in the food that we get from retailers. It's significant. And of course, you all will know, especially in the early days of the pandemic, there was no food on the shelves, in the grocery stores. So therefore, there wasn't, hardly anything for them to be able to donate to us. And so as a result of that, we are having to purchase, just hundreds of truckloads of food to be able to compensate for the fact that we are receiving, far less food that's donated to us. Another way to look at this is we used to get about $2 million worth of food donations every month. So when you look at a 75% decline, we're now having to make up at least $1.5 million, worth of food that we are now purchasing as opposed to getting free that was donated to us before.
And that's just to keep you at the level you've been at. It's not to help meet the increased demand at all. So you're really struggling to keep where you've been.
That's absolutely correct. That's to keep inventory level, if you will, to pre-COVID scenarios. We are seeing anything but, demand being level, to where it was prior. So I mentioned the 300% increase in the number of calls that we're getting, but our partners are also ordering, 300-400% of what they used to, request from us. Because they're seeing the demand, people just coming in and asking for more food and newer individuals coming in. So we've started to project what this will look like for the next few months, given the unemployment claims and things like that. And, it is going to increase steadily, and it's going to be there for several months, if not a year to come.
So you've mentioned your partners a couple of times. How many partners do you have in the region? And could you sort of walk us through the food comes to you, and then how does it get distributed out into the region?
Sure. So our network during normal times has about 450 different community-based organizations who we're affiliated with. So you could think of us as kind of, in business terms, the wholesaler, and our partners being our retailers or distributors, if you will. So that's the network that we operate with and through. And in addition to that network, we have about 300 direct distributions in the community. So where we don't have a partner or we don't have sufficient partners to meet the needs of the food insecure in that area, a truck of ours rolls up and we set up what looks like a farmer's market, and we're distributing food for free to those who need it. So through these 750 different sites, if you will, that's how we distribute what's the equivalent of about 32 million meals every year. So that's how it used to work. At the beginning of this pandemic, many of our partners, uncertain, just like everyone else, and their ability to stay open, worried about, the virus and its impacts. Many of these partners are, fueled, if I can use that word, by volunteers, many of whom are seniors as well, who are, as we all know, particularly vulnerable during this period. So when the pandemic hit in March, as we started to, look at the partner network, in the beginning, we had something like only 70 or 80 of those partners who were open, in those early weeks. That has increased steadily to about 200 partners who are open now, but that's still less than half of our partner network.
200 out of 450.
Correct.
Yeah, and you're still doing the 300 drop-bys?
We've had to stop, so March for us every week presented a different alteration to our operating model, if you will. And so we have not been doing our traditional direct distributions. Usually those direct distributions occur in schools, in communities and in open parking lots and parks, things like that. And obviously schools have closed, lots of changes there that have prohibited us from doing that. So we had to quickly sort of, change our operating model, providing more food to those partners who remained open. In fact, about 20 of those partners raised their hands and said, we can do more and we want to help by doing more. And so we designated them as hubs. And hubs are really organizations that can take a lot more food and service many, many more clients than they would have before. And we have the ability, and we switched to just a delivery model. So, these partners didn't have to come to us with their vans and trucks to pick up the food. We were getting all of the food directly to our partners when they needed it. So that was one of the changes that we've made. The other big one is that we are started to box a lot of the food that we would have distributed directly, in the community. Again, given social distancing guidelines, minimizing exposure, we didn't want people kind of congregating, that we weren't allowed to anyway, congregate in large, groups. And so we were packing, pre-packing boxes that are about 20 to 25 pounds and have enough food to supplement the nutrition needs for a family of four for about a half a week. So those were some of the ways in which we have adjusted our operating model along with our partners to ensure that we get, at least as much food out as we had before, but really a lot more food as we move forward.
So you've gone from 750 distribution points to about 200 now.
Correct, 200 through partners. And then, what we've designated sort of a new category of temporary partners. And these are sites where we're working to have pop-up pantries, if you will, and we've done this in collaboration with county governments, with the district, and at some school sites where breakfast and lunch is being served in a to-go manner. So these are pop-ups. But you're right. I mean, we've gone from about 750 to, I'd say, 225, 230, different ways of getting food out. Correct.
When the demand has increased exponentially.
Absolutely. Yeah. So it's putting a lot of pressure on existing partners. And so I certainly want to thank, the few partners who are on this call now, because we are all interconnected and interrelated. It's not enough for just the food bank to be able to be sourcing all of this food, to meet the needs. Without the network, we're not able to get it out. And it's the same thing for our network partners, right? They are seeing clients coming in directly, but if we are not doing a good job of projecting what that demand is, sourcing that through alternate channels, there's going to be very little to be able to pass through to partners to provide to those in need. So we had some bumps along the way in March for sure, as we rapidly, changed our operations to accommodate for this. But, and as I said, as food, we saw this precipitous decline in food donations, and that just told us instantly, we had to be ordering just dozens of truckloads. And in April alone, we've ordered over 100 truckloads of food. And just to put that in perspective, that's more than we ordered, 3 times what we ordered in the entire last year. And that's what we ordered just in 1 month.
Just for 1 month.
It's significant in terms of what we're trying to source.
And the boxing that you're doing, is that, you have the staff available to do that? How are you handling all that? That's something pretty.
One thing I have to say is this community continues to be so gracious in time as well as in their monetary contributions, if you will, to support our activities and our partners' activities. I bring that up now because there's no way we could pack the 20, 30,000 boxes that we're packing, on a every few week basis if we didn't have the support of volunteers. And so at the beginning, we did see a drop, as one would expect, in volunteers as people were figuring out whether it was safe to come out and engage, et cetera. And we've reoriented the 3 rooms, for those who've been here, for volunteering, so that there are 6 feet, there are X's marked on the floor that are 6 feet apart. We bought gloves, we've got masks, we take the time out to make sure people wash their hands every few hours if they're here for longer shifts, all of these types of things so that it's safe for people to come in and support us. And we do have a cadre of, 1,500 volunteers since the beginning of the pandemic who routinely are sort of on call, for us when we say we have a need. So it's pretty amazing and terrific. And our staff, I have to say, have come in on Sundays to fill in when we needed to with the boxing, just because we will get orders, that need to be, of boxes that need to be sent out. And if our volunteers can't complete them by the end of the week, we have to chip in to get the rest of them done.
It's extraordinary to have 1,500 volunteers coming in the middle of this pandemic. And
it is just incredible.
Each other and getting this food out. That's remarkable.
It really is. There's obviously a lot that's negative and a lot that's uncertain, but we have seen firsthand so many things, and the spirit, that people have to be able to support others. And our volunteers have really been pretty terrific and amazing.
Let's shift a little bit I want to get to the food bank industry across the country, but first the food industry. We're seeing all these reports of farmers dumping thousands of gallons of milk, letting produce go to waste and all that. Are you seeing any change in that? Has the Department of Agriculture stepped up and said we're gonna ship a bunch of this stuff around, or what's the latest you've heard on that?
Yeah, there are a few things that are changing quite quickly around that. And I think, in the beginning, when we all saw those reports, I think, it's important to understand a little bit about how the food system is structured in this country. So over 50% actually of our eating doesn't take place, in our homes with food that we've purchased in grocery stores and are cooking at home. That has dramatically shifted to, eating out in some capacity. And so a good chunk, and I think the numbers I saw were 52% of what's produced, in farms in this country doesn't come to grocery stores, but actually goes to restaurants and other types of, other entities. So that supply chain, obviously, the one that goes to, restaurants was significantly impacted. You talked about Kathy being, your guest, a little while ago. I'm sure she spoke a lot to that, because that, we're hearing 95% declines, in those going to restaurants, even from a takeout perspective. So what they're demanding or purchasing has significantly changed. And so that's where I think we saw a lot of the farmers throwing up their hands, not quite sure what they were going to do, with all of this and et cetera. What we are seeing is a few things that have changed since then. One is the redirection of this to, grocery outlets, food banks, et cetera. And so that took a few weeks to kind of redirect, if you will, that supply chain. And so we're seeing that, and we all see it. Our grocery stores are better stocked, now than they were 5 weeks ago. And so we're seeing some of that redirection of the supply chain take place. The other is the USDA has come up with a new program called the Coronavirus Farm Assistance Program. And it can also be looked at as a food assistance program. It's sort of two sides of the same coin. So they are now buying up a lot of the dairy, the meat, the produce from farmers. So it helps to keep them, provide them with the income that they need. And that is then being distributed through food banks across the country and a few other food service providers as well. So with that program, we are very much in communication with the USDA and those who will help distribute this food nationally, to food banks, so that we can get a good chunk, if not all, of what has been produced. So we'll start to, that is already occurring, and we hope to get some of those shipments to us as early as the next 3 weeks. So I think we'll start to already see some redirection of that, so that it's, it gets to those who need it.
Well, hopefully that'll drive down your expenses and you won't have to buy as many truckloads.
Absolutely. We are absolutely counting on that. We had an average cost of, each truckload varies. The range is somewhere between, $24,000, dollars per truck, depending on the item that you're getting, so that could be for juices or something like that, all the way to $70,000 for tuna, which is a very, difficult item to procure these days, the canned tuna. So there's a whole range there. So when you start to look at hundreds of truckloads, every couple of months, those numbers start to add up quite quickly.
And how do you have the money to do all of that, to buy all those truckloads? Is that
So we started early before our fundraising kind of kicked into gear, just because we were seeing the donations decline. And we know how much inventory we need to keep on hand every week, every month, in order to be able to do the turnover, with our partners that we need. So we started just by using funds that we have reserves, and dipping into some of those. But then very quickly, I mentioned the generosity of our community. We understood what we were up against. We started to share that with donors, large and small, and so many have responded just incredibly generously. The notes that we get with some of these donations are so heartening, from people who are saying, I got a stimulus check, but you know what? My husband and I are working right now, and we don't need this $1,200, or $2,400, whatever it is, as much as our neighbors do. And so we're donating that to you, all the way to a senior that says, nothing's happened with my Social Security, it continues. And so, I have some extra money that I want to be able to provide. And here's a $10 check, and I'll be sending you one every month, so it varies as well. And we've had, obviously, many of our region's corporations step up as well, whether it's Mars or Bank of America, and the foundations of so many of them as well. So we're lucky that we live in a community that responds and wants to take care of its neighbors.
So you've got volunteers and donors sort of coming up to help you meet the demand. That's a great story. It really is very inspiring for this region, and for people to think that we are stepping up to meet the need in a number of ways.
Yeah, it's, for us, I think we've seen this community, there are tremendous inequities within this community. I think many are more and more aware of that, and want to be able to do something to support, whether it's in a small way or in a larger way. And I have to say, as a food bank, we've seen this through the years. We're so grateful that the community is responding now and today in the midst of a pandemic that affects all of us, and with the stock market, having taken the tumbles and the dives that it has, people are still willing to support. But we saw this last year too, during the federal government shutdown. That was fairly sudden. We came back from the end of year, Christmas, winter break, and all of a sudden this was here to stay for a little while, and people were losing their, paychecks and things like that. And our community stepped up then too, to be able to support them. So yes, we are indeed lucky. And I think at this point we're, I talked about how the food bank is interdependent with its partners. I think there's a realization when there's a health pandemic, how important it is for everyone to be as healthy as possible. And certainly having adequate nutrition and food is a critical step in ensuring, sufficient and good health.
So let's talk about the food bank industry. So we've seen across the country, in Texas and California and other places, these lines of cars miles long, waiting to get a box of food, and a lot of times they run out before you get there. And you've seen some lines here in the region, but not anything like that at all. Why is that, and what are we doing to make sure we don't have miles long lines?
Yeah, no, I'm glad you raised that. I think all of us as food banks were, as was society in general, I mean, a little bit caught by surprise, right, in terms of everything that happened and how quickly we needed to adjust. So there are lots of different operating models that different food banks have used to be able to meet the growing need. And I think what you've seen is some experimentation around, let's just have, a day or two during the course of a month, and we'll say we'll be there with 20,000 boxes, of food, and each family can get 1 or 2 boxes. That's when you see, I think, the 10,000 cars, in line. In some ways, it's an expedient. You're just doing delivery on 1 day or 2 days, and getting it out to everyone. But we're seeing some of the bottlenecks and the challenges that come with that, and the frustration, after people wait for hours and they're unable, to be able to get their food. So, there's a little bit of trial and error as different food banks have thought about the best models to use to meet this increased demand. I think here we have always wanted to use our partner network first. It is a terrific partner network. It exists in every neighborhood in our region. And people, of course, are more comfortable going to a place that's, it's in your community. You don't have to drive some distance, wait for hours, all of those types of things. So the model we chose to go with was through the network first, then identifying, as I said, these hubs so that, again, well-known entities that people can go to. And then as a last resort, if you will, these pop-up types of, efforts. And for the pop-ups, we have worked very, very closely with county and district officials. So we've had law enforcement there. We've helped them decide with us what the appropriate sites might be. When we've done it, we've had multiple sites in a county so that it's not all zeroing into, one place where you can get the food. And, we also have had the experiences. We, had 2,000 boxes that we distributed, and we thought, oh, we'll be there for a couple of hours, to distribute those boxes. 32 minutes in, they were all gone, so we know the demand is there, but we're just trying to do it in a manner that, doesn't cause sort of the traffic, the headaches, and ultimately the frustration at the end of the day.
Well, the system you've all set up over the years, it really has turned out to be, I think, the right one in this particular crisis. And I've always said that when you're in a crisis, it's too late to build relationships. You've got to build those relationships before the crisis so that you can call on them during the crisis. And that's what you all have done to a great extent. So you're going to be congratulated and complimented very much for that.
I was just going to say it's a strong network, and I say that because it's also one that is fairly transparent and open with one another. So as I mentioned, as we, had shifted our model and operations, we had to impose at times minimums and maximums in terms of what partners could get from us. And this is different from how we usually operate, but we try to keep the lines of communication open. We try and understand what partner challenges are. So there are bumps, and there will continue to be bumps in this, but I think it's just the openness and the understanding. Ultimately, we all have the same goal, and we're just trying to redirect. And so I have to say our partners have been tremendous in this, just because it's not just been us that have had to adjust, but they've had to adjust as a response to, our changes. And that is the strength of and the resilience, I would say, of the system.
And you said when this started, you had 70 partners that were open. Now you're up to 200. So they're seeing more volunteers come up and come back and
absolutely. They're seeing more, and we are trying to support in other ways too. So we're asking our partners, what is preventing you still? What are the barriers to your being open, more times during the course of a month or longer hours? And so we're hearing things like, is it that, they themselves are having trouble with capacity, or is it volunteers, or they don't have enough PPE, or, what is it? And so as we're hearing more of that, we are trying to support as best we can through, grants for some of these types of things, or as we order masks and gloves and things like that to be able to, order for them. And some of the volunteer partnerships that we're developing are not just to support us at the food bank, but also in some instances to support our partners. So one that I'd like to call out, which is a terrific new partnership that we have, is with the Peace Corps. The Peace Corps, as we all know, they send out thousands of individuals to support with development in developing countries. All of the Peace Corps members, and volunteers have been called back. And so we've got quite a large number of them in the greater Washington metro area. And so we spoke to the Peace Corps about whether they could round up, some of their members to help us as volunteers, and dozens have stepped up already to do that. And so it's not just at our warehouse or at these pop-up distributions, but in some cases, as additional volunteer support with our partners as well.
Well, we love hearing good news stories. Give us some more. You got to have more.
Yes. So,
it's incredible. It's very inspiring to see people rise to the occasion.
No, absolutely. And, as tough as it is to go through this period, every day there's something that comes our way. Again, it's the story of the stimulus checks, and how those are being donated, and people really taking stock of what they need, versus what others need. And I think that's what comes through so clearly in so many instances when we get little notes and cards that come with the donations as well. The volunteers, whether it's through Peace Corps or we're now looking at so many groups within the U.S. government, and as we know that they're, a large employer in the area, and many are working with the federal government. We just heard from the EPA, they're sending a group. USAID has said they're so used to going overseas to support. They've not had that opportunity necessarily, nor has there been perhaps as significant a need as there is right now. And so they're coming through in groups to be able to support, with needs in the local community. And I have to say, just so many companies, really thinking about not just an immediate need and how they're supporting, whether that's Mars that has gone from a few $1,000s a year, they may have supported the food bank before, to $500,000, recently, seeing the need that is growing, or Bank of America or others. But there are just so many who are thinking ahead to their own pipelines and the economic recovery, and how important it is to be able to ensure that people have their health, and a good part of that is adequate food and good nutrition. Otherwise the pandemic hopefully will be over in the next 6 to 12 months or thereabouts, but the issue, if people have gone through a whole year without eating an adequate amount, in terms of meals, or poor nutrition, that will have even longer lasting health implications that will affect us all as a community. And so just seeing how companies and foundations are taking the long view on that and supporting now as a first step towards that has been really gratifying. And I have to just end by saying, the heroes here, I feel, are many, yes, the volunteers, but the staff. I feel like it's a chance, for me to just call out these individuals who are just like everyone else, who leave their families, who come into work, who pull our food, transport it, get it out there, distribute it in the community. We have not, I think we've had one absence, in the last 8 weeks for one day. Otherwise, people are coming in and doing what they need to do.
That's great. That's great to hear. Well, you do have a couple questions from Kim Estes, class of '94. One of them was, in terms of your partners, do you support them with grants to help them with PPE, to help them with other resources? And the second question is, how much of the food that you distribute comes from local farms or growers?
Yeah, both great questions. So in terms of our partners, yes. So there are different ways in which we support our partners. All of our donated food goes out for free to our partners. All of the fresh produce, and it touches on the second question, that we get, much of which from local farms, goes out also for free to all of our partners. When we purchase food, and so we're using our monetary funds, if you will, to do that, our purchasing power is so significant that it is far cheaper, if you will, for a partner to source through us, than it is for them to use their donated dollars and to go to a local retailer to be able to purchase that. And so that comes through us. Given that we're purchasing so much more food, we're also complementing with grants to those partners so that they can subsidize, what, in terms of their own purchasing as well. We just want to make sure that food supply, if you will, doesn't get blocked at any one point and can get out in the quantities that need to be, distributed to those who are most in need. And then getting to the second question, absolutely. We are excited that the local growing season is about to be here. We usually get a good amount from our local farmers from June through November, depending on the growing season, sometimes a little bit longer. And so we are major purchases from local farms, and we will continue to do that. There's no question that we will be doing that and more this year. The difference, I think, this year is that we will have to box quite a bit of the food that comes through before it goes out. In the past, we would have purchased all of the food and then just distributed it through pallets, and people can come through and pick what they want. But now we're going to have to go the extra step of boxing that produce before it goes out to those in need.
And the personal protective equipment you talked about, your staff has it. Do the partners have that, or do you help them get that? Or
so it took us a while, even for our staff, to get masks. We were very conscious that those should be there first for healthcare professionals, and so we had gloves and we had the social distancing, if you will, that we were practicing. Now, as those items are becoming more and more available, we have also ordered them and received them. And so if our partners are in need, we are willing to order more for them. But there's no special source, if you will. We're ordering pretty much, from all the usual sources that others would be as well.
The demand that we talked about, you said your hotline is called to increase 300%. How is that distributed around the region? Where are your food hotspots, and where do you need to send more food?
Yeah, it's a great question. So even under normal...
That came from Lisa Rother. So Lisa, thank you very much for that.
Great. No, thank you. It's a great question. Even under normal circumstances, we use what we call a hunger heat map to be able to target those areas with greater food insecurity. So you can imagine kind of a red, orange, green type of map that highlights those areas that are, in dire need, of food, if you will, and those that, are in need, but less so. So we continue to track that and overlay onto that the calls and the demands, increased demand that we're seeing from partners. So in the month of March, we saw a significant increase in Northern Virginia and in Montgomery County. And this wasn't directly, I think, the result of, it was due to two drivers here. One is more need, but the other was the sustainability of the network in those particular areas. So we've got some partners who've been partners for a long time. There's greater capacity at many of these partner organizations. So they were able to stay open, through this period. And so we saw a lot more ordering and food, if you will, that was going through those areas. We didn't see as many partners stay open in Prince George's County, as an example, but we know that that's the county with the highest number of food insecure in our area. So that's where we complemented with temporary partners, with pop-up pantries, et cetera. So just seeing where the calls come from and where the enhanced orders come from is just a variable, if you will, that we take into account, because it also reflects just the sustainability of the strength of the network in those areas. So we are also, there are various different ways we hear from county council members, we hear from, partners who are closed, but are receiving phone calls and requests. And so that's how we also gauge where we need to be and where we are distributing food. Yet another way that we're looking at that now is looking at the unemployment claims. And so we look at them, we're hawkish in how we look at those on a daily or weekly basis when they're released, because that also, the growth rate there gives us a sense of where, where the needs are likely to be. And we have the ability to overlay that with poverty indicators in each of these areas, because as you know, not everyone who is laid off is going to become food insecure. So there are various algorithms that we use to translate from unemployment to poverty to food insecurity.
So our chair of our board, Mahan Tavkoli, wants to know, has the hunger heat map changed since this has started, and where's the need greatest now?
We are, it's being populated, and we're, adding more of the unemployment claims, if you will, to it. At one level, it's showing, more need in communities that were already food insecure to begin with. So this gap is just widening. So in that sense, the colors and the spots are staying the same. It's just intensifying, in terms of the need there. We are seeing some slight changes. For example, Montgomery County is an interesting one. There's definitely food insecurity in many pockets of Montgomery County, but we're also seeing, because of layoffs that may be occurring at a greater rate there and in Fairfax, the unemployment claims are suggesting more of a need potentially that's growing there than before. But we have to still convert that to those who are, typically you look at those who are making between 40 and say $60,000 or $70,000. If there's a large percentage in that group that are unemployed, then the chance of slipping into food insecurity is higher than obviously those who are making more, and who are unemployed now. So those are all variables that we're looking at. We don't see dramatic shifts at all in the hunger heat map. It's more sort of an intensifying in certain areas. And if anything, it's just, it's shown what we've been hearing about this pandemic. It's taking its toll on those, who are particularly vulnerable to begin with.
So every day the heat map is getting hotter and hotter, basically.
It is, and we continue to update it on our website because every day, new partners come on, et cetera. And so people can go there. It's an interactive map. You can hover above each icon, if you will, that indicates a partner, and you'll see, if they're open, when they're open, how frequently they're open, those types of things as well.
And Kim had another question about food co-ops. Are they part of your partners, or do you work with food co-ops throughout the region at all?
Some of them we do now. Typically, of, I don't know, all 450, there are likely a few, co-ops within that. But what we are seeing now is there are more who are, for example, co-ops as well as organizations like World Central Kitchen and others, who typically are not partners of ours, but are coming to us to say, if you have extra food, we just sent over multiple, 50-pound bags of rice the other day to Dreaming Out Loud, that prepares meals and serves them in east of the Anacostia River. So more and more different or temporary or non-traditional partners are coming on board. And we are more than open to those now, just because we know that there are so many different types of efforts beyond providing groceries, for people that for which our food can be, useful for as well.
So we have a question from Mohammed asking about, besides volunteering, besides giving money, how can we help you in your operations, which leads us into sort of a final discussion of how do we help? What can we do to help you get through this? I know we've got a slide to put up that talks about some things. So
yeah. Well, thank you for that, and for your interest in supporting. Right now, I know it's sort of, we're saying the same thing, but it really is resources that are critical. You heard me mention that we're purchasing dozens and dozens worth of food, truckloads rather of food, and in fact 100 just in the last month. So monetary resources are required. This is going to be a resource intensive effort for months, possibly for the next year. I've spoken to the heads of Giant and Safeway, and they think that their, regular donations to us, food donations, are likely only to resume at the previous levels November, December of this year. So we're looking at 6 months of potentially having dramatically reduced food donations, for which we will have to continue to purchase food. So monetary resources for those who can do it, that is absolutely number one. Volunteering both at the warehouse as well as you'll see many more of these temporary partners doing pop-up distributions and things like that, especially in the summer when we're going to be packing produce and getting that out as well. And that needs to go out really quickly, right? So that it remains fresh. So we will absolutely welcome volunteers, and the weather will be nice in the summer. So hopefully it'll be fun to be out there and, bagging produce and to be able to provide that to folks. And then I think the other thing is just that as we start to pivot to think about our road to recovery, I think there'll be many groups and working groups and subcommittees and groups like that starting to think about this. And it would be really, really helpful, I think, for those who come together to think about including groups like the food bank, because we are working with, by that point, it could be 470,000 food insecure individuals in our region. So there should really be no discussion about how we get back, and get back stronger without groups like ours at the table, because we speak on behalf of so many who want to be a part of this recovery and want to be contributing to our recovery, but we've got to be inclusive in taking their needs and considerations into account as well. So I know the Board of Trade and a bunch of others are, assembling these groups, and I think it would be very important to ensure that community partners are at the table as well.
Well, Radha, thank you very much. This has been a fascinating conversation with you, and very uplifting in many, many ways, of all the help that you're getting, the region responding to your needs and the needs of our fellow residents here. We're at just at our 45 minutes, just a little bit past that. So Radha, thank you very much. We have recorded this. We will send out to everyone link to the recording and in the slides that we had, particularly about how you can contribute and help. But I want to thank you for joining us on this Frontline conversation, and we have some more coming up with Angela Alsobrooks from Prince George's County, the county executive there, and Tonya Wellens from the Community Foundation, and a few others coming up too. So stay tuned to what we're going to provide from Leadership Greater Washington. Radha, thank you so much. Great to
Thanks
chat.
so much, Doug. And thanks to
Thank you.
LGW as well. Appreciate it.
Thank you.